The story of Dr. Kildare.
Whatsoever house I enter, there will I go for the benefit of the sick. And whatsoever things I see or hear concerning the life of men, I will keep silence thereon, counting such things to be held as sacred trust. I will exercise my art solely for the cure of my...
The story of Dr. Kildare, starring Lou Ayres and Lionel Barrymore. Metro-Goldwyn-Mayer brought you those famous motion pictures. Now this exciting, heartwarming series is heard on radio. In just a moment, the story of Dr. Kildare. But first, your announcer. Dr. Kildare, starring Lou Ayres as Dr. Kildare and Lionel Barrymore as Dr. Gillespie.
Parker said you wanted to see me, Dr. Oh, I'm sorry. I thought you were alone.
It's all right, Jim. Come in. Mr. Sarvo, this is Dr. Kildare.
Dr. Kildare?
How do you do, sir?
Jimmy, Mr. Sarvo has presented me with a problem, and I wanted you here as a witness.
Oh?
Mr. Sarvo wants me to examine a man and treat him, but he wants me to do it without knowing the identity of the patient.
Nobody can know his identity. That is imperative.
It's also highly unusual, Mr. Sarvo.
I assure you it is necessary.
It's also necessary that I protect Blair Hospital.
I don't understand.
Oh, that should be rather simple to understand, Mr. Sarvo. For all Dr. Gillespie knows, you may be asking him to treat a criminal or something, a man wanted by the law.
No, I give you my word. The man you will treat is not a criminal. Quite the contrary.
Well, then why can't you tell me who he is?
Dr. Gillespie, I can't even give you a reason. All I can say is that I hope someday I may be able to explain it to you.
Oh, there's one thing we're entitled to know. You didn't choose Blair Hospital and Dr. Gillespie out of thin air for this case.
The choice was made after extensive inquiry. Dr. Gillespie is reputed to be the finest internist available.
How do you know your patient needs an internist?
Because of the symptoms. Severe abdominal pain, general malaise, insomnia. Doctor, it is my understanding that you cannot refuse to treat a patient simply because you do not know his identity.
Oh, just a moment, Mr. Sarvo. Dr. Gillespie hasn't refused treatment.
Then there's nothing further to discuss, is there? I will reserve 2 rooms here at the hospital for tomorrow morning. I'll occupy one of them so that I may be close at hand. And your patient will be admitted to the other under the name of John Smith.
John Smith. All right. Bring him in the morning and we'll have a look at him.
Thank you, gentlemen. I wish I could tell you what a tremendous trust is being placed in your hands.
Oh, just a moment, Mr. Sarvo. Dr. Gillespie, according to the symptoms, we probably should run a GI series.
Huh?
Patient might as well be prepared for it anyway when he comes in, huh?
Yes, of course, Jimmy, that's right. See that your John Smith takes no food or liquid of any kind after midnight tonight. Have him here and ready for examination at 8 o'clock in the morning.
Any request you make will be granted, Doctor.
Yeah. Any request will be granted, Doctor, except telling us who the patient really is.
Someday, frustration of your curiosity will give you an ulcer.
Oh, is that so? When did I ever go around sticking my nose into other people's business?
What was that noise?
I'll bet I know. Since when have you taken over the janitor's job? You were listening at the keyhole. That's what you were doing.
Oh, I was not.
No, you were so. You're just busting to find out who John Smith is.
Why,
Go on. Go back to your work and stop meddling.
Well, you don't have to go hollering just because I'm interested in my job, you know.
Women. Did you ever see anybody so nosy in all your life, Jimmy?
Well, that's a delicate question.
Oh, if a man wants to call himself John Smith, it's nobody's business but his own.
Oh, I quite agree.
Who the devil can he be picking such a silly name like that?
Well, we may find out in the morning while we're finding out what's wrong with him. Now, don't be nervous, Mr. Smith. Fluoroscope can't harm you.
Oh, it just makes it possible for us to see how you're functioning organically.
I quite understand. I won't be a difficult patient.
Oh, I'm sure you won't. Heart looks all right. Move the viewing plate down, Jimmy.
Okay. Get a look at the, Look at this, Dr. Gillespie.
I see it. In the pyloric region.
Have you had difficulty retaining food lately, Mr. Smith?
Yes. Sometimes I suffer from extreme nausea.
Better get a better look at that, Jimmy. Parker, where's the barium mixture?
Right here, Dr. Gillespie.
Give it to Dr. Kildare.
Thank you. Oh, Mr. Smith, I want you to take this glass in your left hand. Got it?
Yes.
Now, this is barium. It's a metallic liquid. Harmless, but it shows up well in the fluoroscope and X-ray. We can trace its course through your digestive tract. I want you to start by taking just one large swallow.
All right, doctor.
That's good, good. Now just hold the glass. I want you to drink the rest of it in a minute.
Use a little hand pressure, Jimmy.
All right.
Force it around the pyloric region.
Let me know if this causes you any discomfort, Mr. Smith. See it clearly now?
Yes, very clearly.
All right, Mr. Smith, drink the rest of the mixture. Take it all down quickly as possible, please. Now, I'll tilt the backboard into table position. I want you to climb up on it and lie down on your stomach. That's it. Now, lie on your right side of your face. Arms above your head, please.
I'll move the view plate, Jimmy.
Thanks.
Hey, there it is. That's the spot.
Yes. All right, Parker, turn off the fluoroscope, put on the lights.
You just stay in that same position for a few minutes, Mr. Smith.
All right.
Want me to call the X-ray technician?
Yeah. Tell him to take 4-quarter views and let's know when they're ready.
After the X-rays are finished, you can go back to your room, Mr. Smith. We'll talk to you later.
Thank you, doctor.
Well, what do you think, Jimmy?
We'll know better when we see the X-rays, of course, but there's a definite growth in the pylorus.
A dangerous growth.
Not necessarily, not unless it's malignant.
Well, if it isn't now, it will be if it's left there much longer.
I'd recommend exploratory surgery unless the plates indicate a benevolent tumor.
I am afraid that what we saw wasn't benevolent.
Here are the X-rays, Dr. Gillespie.
Oh, good. Let's have a look at them.
I'm afraid they don't require very much looking.
Yeah.
You agree?